Thank you. Mr. President, I rise today to talk about Medicare solvency. I know that to many people the words Medicare solvency, which is the ability of the Medicare program to meet its financial obligations, sound like an invitation to a nice nap. But you and I pay into Medicare every month, and we need to know that the benefits that we paid for will be there when we need them, and not just that. I need to know that Medicare will be around to cover my daughter and my new grandson when they become eligible for it. That's what Medicare solvency is about. A couple of weeks ago, we got some good news. According to the annual report released by the Medicare Board of Trustees, Medicare will stay solvent for 2 years longer than previously estimated. Now, there are a lot of things that are contributing to Medicare solvency, but one big thing is health reform. In fact, Medicare will be solvent for a total of 9 years longer than before we passed health reform. I'll say that again. Life of Medicare is 9 years longer today than it was before we passed health reform. As HHS Secretary Sebelius said, the Affordable Care Act has helped put Medicare on more stable ground without eliminating a single benefit. The point is that health reform is not just about making our health coverage more comprehensive. It's not just making sure that when we get sick, we can get the care that we need. It's also making Medicare more efficient. It's extending Medicare's life so that Medicare can keep supporting our parents and will be able to support our kids. How exactly has health reform helped extend Medicare's solvency? Well, to start with, it stopped Medicare from overpaying private insurers. Now, as you might know, seniors can choose to get their Medicare benefits directly from the Medicare program or to get them through a private insurance program that gets paid by Medicare, which is called Medicare Advantage. Before we passed health reform, we were overpaying these private insurers by about 14%. So we reduced what Medicare pays these private insurance companies. In fact, over the next 10 years, we are going to reduce these insurance payments by about 14%, which CBO scored in 2010 as saving Medicare $136 billion over 10 years. Now, I will note that we were told by some of our colleagues that if we did this, insurance companies were going to leave the market, that we weren't going to have Medicare Advantage anymore. Well, so far, enrollment in Medicare Advantage has gone up by 10%. And I'm glad about that because Medicare Advantage serves an important purpose for millions of seniors across our country. We're also adjusting reimbursements to hospitals downward. Now, why and how does that work for hospitals? Well, when you insure 31 million people who previously didn't have insurance, hospitals are no longer on the line for uncompensated care when those 31 million people go into the emergency room. The hospitals aren't left holding the bag for all of those costs. And we didn't just extend the life of Medicare by 9 years. While we were at it, we expanded benefits for Medicare beneficiaries. Now, I go to a lot of senior centers and nursing homes in my home state of Minnesota. And I have to tell you that seniors are very happy about their new benefits. They're very happy about the new free preventive care that they get, the wellness checkups and the colonoscopies and the mammograms. They know and we know that an ounce of prevention is worth a pound of cure. And you know what else we're doing with that money? We're closing the prescription drug donut hole, the gap in coverage under Medicare, where seniors have to pay the full cost of their prescription drugs in that gap. I have to tell you, seniors are very happy about that. You see, for more than 1/3 of seniors, Social Security provides more than 90% of their income, and for 1/4 of elderly beneficiaries, Social Security is the sole source of their retirement income. So when Medicare stops covering the cost of their prescription drugs in the donut hole, that's serious. And sometimes these seniors have to decide between food and heat and medicine. Well, because we have been closing this donut hole, many don't have to make that impossible choice anymore. When I was running for the Senate back in 2008, a nurse in Cambridge, Minnesota, told me that when a senior would come into her hospital and be hospitalized, the senior would be treated by the doctors and nurses so that she would be well enough to leave the hospital. And when she left the hospital, they'd make sure that to give her the prescription that she needed. And after a few days, this nurse would call the pharmacy and ask, has Mrs. Johnson come in and filled those prescriptions? And the pharmacist would say, no, she hasn't. And why? Well, because she was in the donut hole. And guess what? In 10 days or in 2 weeks or whatever, Mrs. Johnson would end up back in the hospital because she couldn't afford her medicine. And these readmissions, they cost our healthcare system a lot of money. But now, because we're closing the donut hole as part of the healthcare law, these seniors are able to get their medicine. This is improving their health, and it's saving us money. So we've increased benefits and extended the life of Medicare. That was done as part of healthcare reform. Many of the provisions of the healthcare reform law will make our healthcare system more efficient and will lower costs in the long run. I want to touch briefly on one that I authored that's already keeping costs down for families in Minnesota and across our country. The provision of the health care reform law that I offered is based on a Minnesota law in a way. In 1993, Minnesota wrote a law that insurance companies had to report their medical loss ratio. Their medical loss ratio. And that's what this piece I wrote in is, not only do they have to, now what is the medical loss ratio? The medical loss ratio is the percentage of premiums that a health insurer receives that go to actual health care, not to administrative costs, not to marketing costs, not to profits, not to CEO salaries, but actual health care. So in Minnesota, starting in 1993, health insurers had to just submit to the Commissioner of Commerce, the Department of Commerce in Minnesota, their medical loss ratio. They had to compute it and submit it. Well, I took that and I made a little wrinkle to it. I wrote something called the 80-20 rule. And it says that insurance companies have to spend at least 80% of their premiums on actual health care for small group policies and individual policies, 85% for large group policies. And if they don't meet that, the health insurer has to rebate the difference. Well, thanks to this provision of the law, last year more than 12 million Americans benefited from $1.1 billion in rebates from insurers that did not meet the 80-20 rule, including 123,000 consumers in Minnesota. And a new report from the Kaiser Family Foundation estimates that premiums in the individual market would have been $1.9 billion higher last year if it weren't for the medical loss ratio rule, and that they would have been $856 million higher in 2011. That's more than $2.75 billion in savings over the last 2 years alone. And those savings are in addition to the rebates that consumers received. They're estimating that insurers would have raised their rates that much more, $2.75 billion more, if they hadn't had to meet the 80-20 rule. That's another important way that the health reform law is keeping health care costs down. So my rule that I wrote has already saved Americans nearly $4 billion in health care costs. In fact, after going up at 3 times the rate of inflation, I would ask the presiding officer if I could have another minute.
Is there objection? Without objection.
Okay, thank you. In fact, after going up at 3 times the rate of inflation for a decade, over each of the last 2 years, health care costs have gone up less than 4% for the first time in 50 years. That's according to data released by the Department of Health and Human Services. I'm not saying we're done, not by any stretch of the imagination. We have more work left to do. In fact, one big thing that we could do would be to allow Medicare to negotiate directly with pharmaceutical manufacturers on the price of their drugs. The VA does this, and they pay nearly 50% less for the top 10 drugs than Medicare does. I have a bill to allow Medicare to negotiate directly with the pharmaceutical manufacturers, and I hope to work with my colleagues to bring this proposal to the floor. At the end of the day, my job is about strengthening what works in our country and fixing what doesn't. Medicare works. It works for seniors across the nation. It works for grandparents from Pipestone to Grand Marais. And I hope to work with my colleagues to protect Medicare benefits for our parents and grandparents while strengthening the program for our children and grandchildren. Thank you, Mr. President, and I yield the floor.